Hello, everyone, and welcome back to the Mr. Jobs English podcast, where we talk about real professions and help you grow your English in a natural and fun way. My name is Mia.
And I'm James. We're happy to have you here with us again. If you want to improve your English while learning about real jobs that exist around the world, you're in the right place.
Today's profession is one that is loved, respected, and absolutely essential in every country. We're talking about the nurse.
Yes, the nurse. A profession full of responsibility, teamwork, long hours, and a lot of care for people. Nurses are heroes in hospitals and clinics, and they help patients every single day.
And this episode will be extra special because the vocabulary is useful not only for nurses or people in the medical field, but for everyone. At some point in your life, you'll go to a clinic or hospital, and these words will help you understand English better.
That's true. You might need them while traveling, living abroad, or even watching medical shows in English. And medical shows use a lot of nurse vocabulary.
So, let's start by answering a simple question. What does a nurse do? A nurse takes care of patients, gives medication, checks vital signs, assists doctors, and supports patients and families during treatment.
Yes, the key word is care. Nurses care for patients physically and emotionally. They don't just give medicine, they comfort people, listen to them, and help them feel safe.
That's a great point. And since today's episode is about a nurse in a hospital, we'll focus on vocabulary from hospital environments. Let's start with some essential words that nurses use every day.
Good idea. One of the most important words is patient. A patient is a person receiving medical care. For example, the nurse is talking to a patient in room 12.
Another essential word is vital signs. Vital signs are measurements that show how the body is working. The main vital signs are heart rate, blood pressure, temperature, and breathing rate. A nurse checks vital signs regularly during the day.
Heart rate is the number of heartbeats per minute. Blood pressure is the force of blood in the arteries. Temperature shows if the person has a fever. And breathing rate shows how fast they are breathing.
Nurses also give medication. Medication means medicine or drugs used to treat a patient. For example, the nurse gave the patient medication in the morning.
And before giving medication, nurses often need a prescription. A prescription is the doctor's instruction for what medicine the patient should take and how much. For example, the doctor wrote a prescription for antibiotics.
A very common word in hospitals is shift. A shift is the period of time someone works. Nurses often work day shifts, night shifts, or long shifts. For example, she works the night shift at the hospital.
And speaking of long shifts, nurses work very hard. Some do 12-hour shifts. That requires a lot of energy. I can barely stay awake for 12 hours straight.
Oh, trust me, nurses don't just stay awake. They're running around helping everyone. Their day is full of action. And another word they use is chart. A chart is a document where nurses write information about a patient, such as vital signs, medication, and progress.
Exactly. A nurse might say, I need to update the patient's chart. And the place where nurses work is the hospital or clinic. A hospital is bigger and for more serious care. A clinic is smaller and for general medical services.
Now, James, I have a question for you. If you are a nurse, what would be the most difficult part of the job for you?
I think the emotional part. Seeing patients sick, scared, or in pain would be tough. Nurses need a lot of emotional strength and compassion. What about you?
For me, it would be staying calm in emergencies. Nurses need to react fast and make smart decisions. That requires a lot of training and confidence.
And teamwork, too. Nurses work with doctors, surgeons, technicians, and other nurses. Communication needs to be clear. Sometimes they use short phrases to save time, especially in emergencies.
Yes. For example, stat means immediately, used when something is urgent, and code blue is used when a patient is not breathing or their heart has stopped. These are serious situations.
True, and we'll introduce more hospital expressions later. For now, let's stay with basic but important vocabulary so our listeners can build a strong foundation.
Agreed. Before we continue, if you're enjoying this episode, follow or subscribe to the podcast, leave a like, and share it with someone learning English. Your support helps us bring more episodes for you.
And tell us which profession you want to hear next. We love reading your suggestions. Ready to continue?
Absolutely. Let's keep going with more practical vocabulary and real-life situations nurses experience every day. One thing nurses do all the time is check on patients. To check on someone means to see how they are doing or feeling. For example, the nurse checked on the patient after the surgery. Nurses check on patients many times during a shift.
Another useful word is ward. A ward is a section of a hospital where patients stay. For example, she works in the pediatric ward, which means the area for children.
Yes, and different hospital wards have different routines. For example, the emergency room, often called the ER, is a busy place where people go for urgent medical help. Nurses in the ER need to think and act very fast.
The ER can be intense. A nurse might say, "We have a new patient coming into the ER," and everyone gets ready. I would panic and drop everything.
Me too at first, but I think nurses become strong because they face so many situations every day. Another important word is nurse station. That's the area where nurses work, make calls, update charts, and organize information.
Yes, the nurse station is like the headquarters of the floor. And floor is another word used in hospitals. Instead of saying level, they say floor. For example, the patient is on the third floor.
Another common activity is taking blood. Nurses often need to draw blood for tests. To draw blood means to take a small amount of blood from a patient, usually from the arm, to check their health.
And those tests are called lab tests. Lab is short for laboratory. The lab checks the blood, urine, or other samples to help doctors understand what the patient needs.
Nurses also use equipment daily. For example, a thermometer to check temperature, a stethoscope to listen to the heart and lungs, and a blood pressure monitor. These are basic tools for nurses.
Stethoscope is a great word to practice. For example, the nurse used a stethoscope to check the patient's heartbeat. And I always feel like a doctor when I say that word.
It does sound professional. Another key word is injection, which means when medicine is given through a needle. Some people are scared of injections, but nurses are experts at making them quick and gentle.
Some nurses give vaccines too. Vaccines protect us from illnesses. For example, the nurse gave the child a vaccine at the clinic.
A very important part of a nurse's job is communication. They talk to patients, explain procedures, and give clear instructions. For example, please take this medication with food, or you need to rest.
And empathy is a big part of their job. Empathy means understanding how someone feels and showing care. Nurses use empathy every day to support patients emotionally.
Nurses also deal with families. Imagine a family worried about a loved one. Nurses communicate calmly and clearly to explain what is happening. That takes patience and kindness.
You said a magic word there. Patience. Patience is important for everyone in healthcare. And don't confuse patient with patient. They sound similar, but they are different. Patient is the sick person. Patience is staying calm.
Yes, and nurses need a lot of patience because they repeat information many times, answer questions, and handle stress. They are amazing.
Before we move into more vocabulary and real situations from a nurse's daily routine, I want to ask you something, Mia. If you could choose one area to work as a nurse, which one would match your personality?
Ooh, I think I would work in pediatrics with children. I love kids, and I think I would make them laugh even if they were scared. I would probably use funny bandages or draw a smile on the glove to make them feel better.
That fits you perfectly. I can imagine you making a balloon animal out of a medical glove. I think I would work in the emergency room. It's intense, but I like action and fast decision making.
Wow, really? You want the adrenaline? I would faint. But that's the cool part about nursing. There are many types of nurses, and each one can choose a path that matches their skills and personality.
Exactly. And later we'll talk about different types of nurses because not all nurses do the same job. There are hospital nurses, clinic nurses, ER nurses, pediatric nurses, and many more.
For now, we hope this first part of the episode is helping you build a strong foundation. We're introducing words that you will hear a lot when people talk about health, hospitals, or medical care in English.
If you're learning with us right now, keep listening because the vocabulary will get more practical and connected to real hospital situations.
And if you're enjoying this episode, don't forget to follow the podcast, leave a like, and share it with someone who wants to learn English with real job-based conversations.
And send us a message telling us where you're listening from. We love seeing listeners from different countries.
Ready for more? Let's continue and explore what a nurse's daily routine looks like in a real hospital environment. You know, James, I once visited a friend who's a nurse in a big city hospital. She told me about a night shift that she'll never forget.
Oh, really? What happened?
Well, it was 3 a.m. and the emergency room was packed. One of the patients had severe chest pain, and the doctor suspected a heart attack. My friend had to stay calm, check his vital signs, and call for immediate assistance.
That sounds intense. What did she do first?
She checked his blood pressure, heart rate, and oxygen level. Everything was unstable. So she used the intercom and called a code blue. Within seconds, the whole team ran in, the doctor, the technician, and another nurse to help with the defibrillator.
That must have been so stressful.
Totally. But she said in moments like that, training takes over.
Mm-hmm.
She started CPR while the doctor prepared the injection and the defibrillator. After a few minutes, the patient's pulse came back.
Wow, that's incredible. She probably saved his life.
She did. Later, when things calmed down, she went to check on him again. The man smiled weakly and said, "Thank you for not giving up on me." She told me that moment made all the stress and exhaustion worth it.
That's powerful. Nurses don't just work long shifts. They carry emotional stories every day.
Exactly. It's not just about medicine and charts. It's about connection, empathy, and hope.
That story reminds me how important it is to appreciate nurses. They face pressure, emergencies, and fatigue, but they still manage to care deeply for people.
Yes, and that's why we admire them so much. Now, before we move on, let's review some of the important words from this story, all very common in hospital situations.
Good idea. First, we heard code blue. It's an emergency code used when a patient is not breathing or when their heart has stopped.
Then we mentioned defibrillator. That's the device that gives an electric shock to restart the heart. You've probably seen it in movies where someone says, "clear," before using it.
Exactly. We also said CPR, which stands for cardiopulmonary resuscitation. It's a life-saving technique that helps someone whose breathing or heartbeat has stopped.
Right. And we talked about injection, which is when medicine is given through a needle, usually directly into the body.
Finally, there's pulse. That's the heartbeat you can feel, usually at your wrist or neck. When someone says the pulse came back, it means the person's heart started beating again.
These are essential words for anyone learning English for healthcare or emergency situations. You'll often hear them in hospitals, on TV shows, or even in first aid training.
Perfect. Now that we've reviewed this powerful story and its vocabulary, let's continue exploring more useful phrases and real hospital situations nurses experience every day.
A nurse's day usually starts with something called handover. Handover means passing important information from one nurse to another at the start or end of a shift. For example, We had handover at 7 a.m. with the night shift nurse. It helps everyone understand what happened with each patient.
Yes, handover is like sharing updates. Nurses talk about patient conditions, changes, medications, and anything important. Clear communication here is super important, so nothing is missed.
After that, nurses often make their rounds. To make rounds means to visit each patient, check how they are, and see what they need. For example, the nurse is making her morning rounds. It's like checking in room by room.
Speaking of rooms, rooms in hospitals usually have numbers. A nurse might say, I'm going to room 203 for a blood pressure check. And sometimes rooms have 2 or 3 patients, so nurses must stay organized.
Another very important word is symptoms. Symptoms are signs that a person is sick. For example, fever, cough, headache, nausea. A nurse may ask, what symptoms are you feeling? Or, do you have any pain?
And pain is a big topic in hospitals. Nurses always check pain level. Many hospitals use a pain scale from 0 to 10, where 0 means no pain and 10 means the worst pain. So a nurse might ask, what's your pain level from 0 to 10?
Yes, and if the pain is strong, the nurse may give painkillers. Painkillers are medicines that reduce pain. For example, the nurse gave the patient a painkiller after surgery. Some are strong and require a prescription. Others are simple, like ibuprofen.
One of the moments many patients worry about is procedures. A procedure is a medical action or treatment. It could be small, like changing a bandage, or bigger, like preparing for surgery. Nurses prepare patients and explain what will happen.
A bandage is material used to cover and protect a wound. A wound is an injury to the skin, like a cut. Nurses change bandages to keep wounds clean and prevent infection. For example, the nurse changed the patient's bandage in the afternoon.
Infection is an important word. Infection is when bacteria or a virus enters the body and causes illness. Nurses are very careful to prevent infections, which is why hygiene is a big part of the job.
Hygiene means keeping things clean to stay healthy. Nurses wash their hands many, many times a day.
Yes, more than anyone else, I think.
They use gloves, masks, and sanitizer to keep patients safe.
Another word that listeners should know is treatment. Treatment is the care or medicine given to help a patient get better. For example, the doctor chose a treatment for the patient's infection. Nurses help follow the treatment plan.
Yes, treatment plan is the steps needed to help a patient recover. And recovery means getting better after an illness or surgery. A nurse might say, the patient is recovering well.
A big part of nursing is monitoring. To monitor means to watch or check something carefully over time. For example, the nurse monitored the patient's heart rate for 2 hours. Nurses monitor patients all day long.
Sometimes patients need tests, medicines, or checkups at specific times. A checkup is a general medical examination to evaluate health. For example, the nurse prepared the patient for a checkup with the doctor.
And not all patients stay in the hospital. Some come for an appointment and leave the same day. An appointment is a scheduled time to see a doctor or nurse. For example, my appointment is at 10 a.m.
A nurse also comforts patients. To comfort means to make someone feel calmer, safe, and supported. Sometimes a warm smile, a friendly voice, or a short conversation can help a lot.
And smiles really do help. My smile would probably scare some patients, but I would try.
Don't worry, confidence is the key. Nurses need confidence because patients trust them. Confidence means believing in yourself and your abilities. A confident nurse makes patients feel safe.
Something important that many people don't realize is paperwork. Nurses write a lot. They document everything: medication times, symptoms, tests, results, and progress. Document means to record information officially. For example, the nurse documented the patient's temperature.
Yes, paperwork is not the most exciting part, but it's essential. If something isn't documented, it's like it didn't happen in the hospital system.
Mia, I'm curious, what's one thing you think a nurse should never do?
I would say never ignore a patient's concern. Even if something sounds small or silly, patients may be scared or confused. A nurse must listen carefully. Listening is a huge part of the job.
Great point. Listening builds trust. And trust is important because patients need to feel safe to share personal information about their health.
Before we continue with more real-life hospital situations and useful expressions nurses say during a typical workday, I just want to remind our listeners, if this episode is helping you learn English, follow our podcast, leave a like, and share it with someone who is learning English. Your support helps us create more episodes for you.
And tell us in the comments if you know a nurse or if you have ever received care from a nurse. We love reading your stories. Ready to keep going?
Yes, because we still have so much useful English to learn about a nurse's daily routine. Let's continue because nurses face so many situations every single day, and we want our listeners to understand useful vocabulary for real hospital moments. Earlier, we talked about basic responsibilities, but now let's go a little deeper into what a nurse's day actually looks like.
Yes, let's walk through a typical moment in a hospital. Imagine the nurse arrives, gets a quick report from the previous shift, and immediately starts checking on patients. One word nurses use a lot is rounds. Rounds means visiting each patient to check on them. For example, the nurse is doing her morning rounds.
And during rounds, nurses often monitor patients. Monitor means to watch carefully. A nurse might monitor pain levels, blood pressure, or how a patient is recovering after surgery. For example, the nurse is monitoring the patient after the operation.
Another important word is symptoms. Symptoms are signs that something is wrong in the body. For example, fever, cough, pain, nausea. A nurse might ask, "What symptoms are you experiencing?"
And related to that is the word diagnosis. Diagnosis is the name of the condition a patient has after the doctor identifies the problem. A nurse needs to communicate clearly with both the patient and the doctor about symptoms and diagnosis.
Communication is huge in hospitals. Nurses need to be calm, clear, and sometimes fast. For example, a nurse might say, "The patient in room 8 needs assistance," or "The patient's condition is improving."
Speaking of assistance, nurses help with many tasks like mobility. Mobility means the ability to move. Some patients need help standing up, walking, or moving from a bed to a chair. A nurse might say, "Let me assist you with mobility."
And sometimes nurses need to transport patients. Transport means moving a patient from one place to another, like from their room to the X-ray room. For example, the nurse transported the patient to radiology.
Radiology is the department where medical imaging happens, like X-rays, CT scans, and MRIs. Nurses also work closely with laboratories, often called the lab, where blood tests are done.
Exactly. And since we mentioned blood tests, one common word is sample. A sample is a small amount of blood, urine, or tissue taken for testing. For example, the nurse collected a blood sample.
Many people are afraid of needles. I know I'm not a fan. The tool nurses use to draw blood is called a syringe. And when the needle enters the vein to take blood, that's called a blood draw.
Some people look away, Some people talk to distract themselves, and some people pretend to be brave, but you can see the fear in their eyes.
True. And after taking blood, nurses need to label the sample correctly so the lab knows which patient it belongs to. A mistake here can be dangerous, so accuracy is very important for nurses.
Now, since we're talking about tools, let's introduce a few more common items nurses use every day. A stethoscope is the instrument used to listen to the heart and lungs. For example, the nurse used a stethoscope to check the patient's breathing.
Another one is thermometer, used to measure body temperature, and blood pressure monitor, also called a BP monitor, is used to measure blood pressure.
Don't forget gloves. Nurses must wear gloves for hygiene and safety. Hygiene means keeping things clean to prevent infection, and infection is when a bacteria or a virus enters the body.
Infection control is a huge part of nursing. Nurses wash their hands constantly, use sanitizer, wear masks when needed, and follow protocols to protect everyone. Protocols are official rules or procedures.
Protocols are especially important in emergencies, and now I want to talk about emergency room vocabulary, because this is something people hear a lot in movies and TV shows.
Yes, the emergency room is often called the ER, and nurses working in the ER must act fast. You often hear words like urgent, critical, and stable.
Urgent means it needs quick attention, critical means the situation is very serious, and stable means the patient is okay for now and not getting worse.
Nurses might say, "We have an urgent case coming in," or "The patient is stable now." And when a patient arrives at the ER, the first step is triage. Triage means evaluating the patient's condition to decide who needs care first.
Triage nurses are amazing. They must think fast and ask the right questions quickly. Where does it hurt? How long have you had this symptom? Are you allergic to any medication? They collect essential information in seconds.
And another important word in hospitals is routine. Routine refers to regular tasks done daily. For example, the nurse has a morning routine of checking patients, giving medicine, and updating charts.
But not everything is routine. Hospitals are full of surprises. One moment, everything is calm, and 5 minutes later, chaos. Nurses must adapt quickly.
That's so true. And nurses use a lot of soft, kind language when talking to patients to help them feel safe. For example, "You're going to be okay. I'm here to help you." Or "Let me know if you feel any pain."
That comfort makes a huge difference. A nurse's tone of voice can calm a patient, especially in scary situations. Emotional support is part of nursing, too.
Before we wrap up, let's do a quick and simple review of today's vocabulary so listeners can remember the most important words.
Great idea. Let's go one by one.
Nurse, the medical professional who cares for patients. Patient, the person receiving medical care. Vital signs: heart rate, blood pressure, temperature, breathing. Medication, medicine to treat a patient. Shift, the time period the nurse works. Chart, the document with patient information. Rounds, when nurses visit patients to check on them. Symptoms, signs that something is wrong in the body. Diagnosis, the name of the medical condition. Monitor, observe carefully. Sample, small amount taken for testing. Stethoscope, tool to listen to heart and lungs. Hygiene, keeping things clean to avoid infection. Infection, when a bacteria or a virus enters the body. ER, emergency room. Triage, evaluating who needs care first. Critical, stable, urgent, emergency condition levels.
If you remember these, you're already improving your English in a very practical way.
Exactly. And if you enjoyed today's episode, make sure to follow or subscribe, leave a like, and share this podcast with someone who is learning English. It helps us a lot.
And tell us in the comments which profession you want us to talk about next. We love seeing your suggestions.
Thanks for listening. Take care, and we'll see you in the next episode.